Yeah, I know a couple of you, but it's been amazing as the initiative's grown to see so many people who are nothing to do with me, nothing to do with triathlon, and are coming into it from all different walks of life. So we didn't really have an agenda. I'll keep it really informal, but I thought what I would do is just go briefly through some of the evidence that we have about why exercise is important for people living with and after cancer. Um, I'll try and keep it fairly simple, but you might find it quite interesting. I actually wasn't, people don't believe this, but I really wasn't a sporty kid. When I was growing up, I hated running. I came dead last in a cross country when I was 13, and it put me off doing anything competitively at all until I was at university. Well, until I was second year doctor, second or third year doctor. Um, but I found exercise at university. I fell in love with it. I knew how much happier it made me as a person. And long story, very short, involving drunken dares in nightclubs, I ended up being a professional triathlete. And I came back to work. I'd had 8 weeks out of not seeing patients. I've been doing some research, but spending a lot of time just doing sport. And when I came back, I remember things had changed, like treatments for cancer had changed. So melanoma, skin cancer that had spread when I left, it was a death sentence. People died within a year. When I came back, immunotherapy, which is one of the treatments that we use, was around, and all of a sudden, people that had melanoma that spread all around the body could somehow be could quite often be cured. So it was a completely different world. But with that increasing kind of cure rates, I realized how many people were living with long-term side effects of treatment. And I just felt intuitively exercise should make a difference. It should be something that we should be kind of thinking about. I'd had a friend who'd been depressed, I'd seen how it helped them. And it was a young patient who I met who was in his early 20s. I hadn't treated him. I'd just gone onto the ward on the teenage cancer ward to give him a prescription, and we got chatting. And he told me how he'd been through his chemotherapy, his radiotherapy, his surgery, and theoretically had been cured of his cancer. But what he'd lost in the process was pretty much everything. He'd put on several stone in weight, he'd lost his partner, he'd lost his job, he'd lost most of his friends, and he was spending most of the day asleep and most of the night awake playing computer games. And I will never forget walking off the ward and just thinking, what are we doing if we're curing people? And that's the life that we're left with. And that conversation was really what led me to the idea of 5K Your Way, which we started with Gemma, who founded Move Charity in June 2018. And that conversation, I had this idea, maybe there might be a world where we could get groups of young people who'd been through cancer treatment to build up to walking or running a park run every 3 months or so. Um, but it also led me to delve into the evidence. And when I touted the idea of kind of a running club, which is what I was kind of thinking it might be at the start, to people in the hospitals, they said, no, absolutely not. It's not going to work just because you love running, Lucy. People with cancer won't want to be told to run. But I started looking into the evidence, and actually there was a lot of evidence. And I thought I've got this gut feeling there's also quite a lot of evidence. So that's what that was a bit of a ramble, but this is what I'm going to talk to you, run you through quickly today. So, guidelines for physical activity. I suspect most of the people on the call are pretty active because you're all part of 5K Your Way for a reason. But the UK guidelines, they're aspirational. They're not saying that you have to meet those, but people should aspire to move 150 minutes a week of moderate intensity exercise. Just interesting to have that fact. So that basically means that you could talk, but you probably can't sing, or do a bit less but more intensive exercise. So loads of headlines in the news. This year you might have seen some really exciting headlines because we did have the biggest or the first big randomized controlled trial, which I'll talk to you about. But this is so exciting for any of us that kind of have been talking about exercise in a professional capacity for people with cancer, because there was a really big trial that proves that exercise reduces risk of recurrence. So that should be a game changer. Um, so as an oncologist, what do? I prescribe drugs. For me, I just use chemotherapies. A lot of us use immunotherapies. Often use I don't treat with radiotherapy, but a lot of oncologists obviously do. And we can't get away from the fact that most of the drugs we use have horrible side effects, both in the short term and long term. And I suspect some of you on the call have had cancer or maybe are living with cancer, and will have some of those side effects yourself. They can be really disabling, really life-changing. It can be quite a negative thing to do as an oncologist, actually, when you have a conversation with a patient and you talk them through the treatments, and then you get those horrible consent forms and you tick off these side effects and these side effects and these side effects and these side effects. Um, so we know that the drugs that we use have side effects, obviously, that can be really life-changing. Can exercise be something that could help them? Well, actually, it can. Something just an interesting fact. It might be a little bit scary for those of you who have had chemotherapy, but it's quite an interesting one for healthcare professionals. There's some evidence that even fairly short courses of chemotherapy can, in the short term, cause the same physiological effects as aging, as a decade of normal aging. So it's really scary when you look at the short term, and some of those may persist long term, particularly long term impacts on the heart. But short courses of chemotherapy can have massive effects on the body. So the cost of the treatments of cancer for patients is massive. So, what do we know for sure about exercise? What do we absolutely know as a fact? So, we know that it is the best treatment for cancer-related fatigue. So many of you who have had cancer, so many people, a massive proportion of people who've been through cancer treatment or are living with cancer treatment can struggle with fatigue that is very different to normal fatigue. It doesn't get better with rest. It's often not related to activity levels. It's not just like normal tiredness. I think it's really hard to articulate to anyone who's not understood it, who's not been through it. Um, so physical activity, there have been loads of studies. Physical activity and movement is the best way to manage cancer fatigue. So that's a really important myth, I think, that we can bust, because it is, and again, it's quite a challenging conversation to have. If someone's feeling tired, they're not going to intuitively understand that being active is something that might help them, and certainly for loved ones, it's probably not the obvious answer. But exercise is the best treatment for cancer associated fatigue. It's better than any drug or psychological intervention. We know it improves health-related quality of life. We know it reduces depression and anxiety. And that was one of the things I saw with a friend that was depressed, actually, that first kind of got me interested in this field. And we know that it improves physical functioning. So well, I guess how fit people are. But there is actually also some evidence that cancer might improve how well people cope with chemotherapy. So it might mean that there's some evidence that we're more able to get the full doses of treatment in. So people are less likely to require dose reductions. They're less likely to require hospital admissions during treatment. They're more likely to get through the whole course of chemotherapy. There's also some evidence that exercising during your treatment might make it easier or accelerate how quickly people can get back to work after they've finished their treatment. But there's also, I can't see whether anyone's listening, so I'm really sorry, but I hope it's, I hope you're very, I hope I'm not
We
making
are.
sense. I hate talking.
Yes, we're there.
I
We're all
hate talking.
listening.
It's so much harder than doing it live, isn't it? You just talking itself, all you can see is yourself. Um, anyway, so can it I've lost my train of thought now. Prehab. So there's really good evidence that exercising before cancer treatment, so most of the evidence is for surgery, but there's really good evidence that exercising before your treatment can improve your tolerance to your treatment, particularly surgery. And it's really interesting if you just give patients 2 weeks of structured exercise programs, their fitness can improve so dramatically that in lung cancer, they've shown that the hospital stays are reduced by several days. So even really short, kind of focused, supported exercise can be really, really powerful. And I think when you think of the physiological demands of major surgery, it makes complete sense. I don't know if we've got any marathon runners or crazy distance runners on the call, but no one's going to turn up and run a marathon without training for it. So why would anyone go to surgery without training for it? So it makes complete sense, but there's now really good evidence for that. And actually, prehab is being offered to a lot of people with cancer across the UK now. So we know it makes people feel better. We know it improves their health-related quality of life. It probably, well, it certainly does improve treatment tolerance in some cases, but there's also some evidence that exercise might improve how well your cancer drugs or your radiotherapy works, and perhaps even slow down the growth of the tumours. We don't really know why, but there are quite a lot of animal studies. So if you give animals access to a treadmill or a running wheel, they've shown that that improves the treatment response in mouse models of cancer. And it seems to be that if you give animals access to exercise, the growth rate and the kind of rate of spread of their tumours is also much reduced. So there are animal studies that seem to show that it improves how well cancer treatments work and perhaps actually slows down how quickly cancers grow. Um, but there's also now quite a lot of epidemiological evidence for quite a tight correlation between how much people exercise and survival from cancer. So there was a really big study in breast cancer. I think it was about 23,000 people who'd had breast cancer treatment. And they looked at the women who were the most active and compared them to the women that were the least active. And those who were the most active had a 40% lower risk of breast cancer mortality. 40%, like that is absolutely massive. And those figures are completely astounding. And there's also what we know now is a lot of the drugs that we use have negative impacts on the heart, on the hormone systems, and a lot of those negative connotations can be improved by being by being active and fit. So this is a really exciting study. So this is the one that made the headlines, and I think it should still be making the headlines, but it's not. So June 2025, they published the results of the challenge trial. In the way we test drugs in oncology, we tend to, or the best way to prove whether a drug works or not, you randomize groups of patients to either get the drug or get the dummy drug, and you look to see what happens between those two groups of patients. And obviously, what you want to see is that the people that get the drug have a better response rate or a longer survival or whatever the outcome is that you're looking at. So this was the first trial that tested exercise exactly the same way as a drug. So they got nearly 900 people who'd finished chemotherapy for bowel cancer, and they randomized them either to get supported exercise interventions for 3 years or just to get some generic information about activity and healthy living. So the patients that were in the trial weren't particularly different to any normal cohort of patients. None of them met the UK guidelines for physical activity already. So none of them were meeting those 150 minutes of exercise a week, but they were all able to walk casually for about 6 minutes. So they were median age was 61. So they were a general population of people with bowel cancer. And what it showed, so the results, firstly, the patients in the exercise group were more active. So they were randomized to get, I will tell you exactly what it was. It wasn't that intensive. So they got 12, in the first 6 months, they got 12, so once a fortnight, in-person support sessions with every 2 weeks. They had 12 mandatory supervised exercise sessions and then 12 recommended supervised exercise sessions. The second 6 months, it reduced down a little bit, and the years 2 to 3, there were mandatory monthly in-person or remote behavioural support sessions. So a bit like the Weight Watchers model, checking in, how active are you still doing your exercise, etc. And if they attended face-to-face, they got a supervised exercise programme. So it was much more than we're giving most people when they finish their cancer treatment, but it wasn't super intensive. The goal of the exercise, and this is what I think is really interesting, was to increase people's activity level by the equivalent of about 2.5 hours of brisk walking a week. So it's not, we're not asked, they weren't asking people to go and run marathons or go and do HIIT classes or anything crazy. It was 2.5 hours of brisk walking a week. So that's 5 30-minute brisk walks. But people, they could choose how they exercised. Anyway, the results, so the people that were randomized to the exercise arm, their risk of bowel cancer recurrence was reduced by 28%. Their risk of death from bowel cancer was reduced by 37%. So at 8 years, though 90% of people in the exercise program were alive, compared to 83% in the control arm. Um, they obviously showed they got fitter. Actually, the people in the exercise arm, on average, were walking about 90 minutes extra than the people that were just given the information leaflet. And the only side effects were musculoskeletal side effects. So basically, stiff muscles. That was the only side effect. So that is absolutely groundbreaking. I can't even begin to tell you how excited I was when I saw that because it's the first trial that's proven exactly what we've been preaching about, what I've known within myself for so long. Exercise does reduce the risk of cancer recurrence. And this might not mean much to some of you, but to anyone, any oncologist, this is the bit that gets my colleague over the line. So this shows the benefit from exercise. So adjuvant is any drug, anything that is used after cancer treatment to try and reduce the risk of recurrence. The absolute overall survival gain is that difference between the 83% and the 90% who are alive at 8 years. So adjuvant exercise after treatment, 7% overall survival. And then these are all the other drugs that we use in different conditions. So it shows that exercise is just as good, if not better, than a lot of the other drugs that we use to reduce the risk of recurrence with all the side effects that go along with it. So it's absolutely groundbreaking. It's disappointing that it's not triggering as much change as I would have hoped it would, but certainly means that when I go and talk to healthcare professionals, I've got a much easier sales pitch than I did before this study was produced. So there's still a huge amount that we don't know. You look at all the exercise studies and they talk about how much and what dose and which bits of exercise might improve which things. I don't think we need to overcomplicate it. I think at Move Charity we talk about movement, and I think the most important thing is that people with cancer are aware that movement is one of the very best of the things that they can do. But I do think the new study shows that we do have pretty good, I think we've got proof now that exercise reduces risk of cancer recurrence. So as a doctor, we should be telling all our patients, we should be giving them that information. I remember we've got a young man who comes down to Nottingham 5K every now and then, and he's had blood cancer and he's had horrendous treatment. And I wrote a blog when the study came out. When he turned up, we were chatting about it. He was like, well, why did no one tell me? I can't believe no one told me. He was really angry that he'd not been given that information. And that's what I trying to spread that message to all my colleagues. We should be telling patients about it. Um, Generally, it's safe. There aren't really too many things that we need to worry about as doctors. Um, for nearly every single person with cancer, it's better to be active than it is to be inactive. I don't think you need to go into specifics, but we have on the Move website got a really good article. Josie, maybe we could link to it. Written by Carolyn Garrett, who had breast cancer, but she's also a cancer rehab instructor. So there was a big summary paper published a couple of years ago, consensus statement about exercising with bone metastases, so cancer that spread to the bones. Long story short, it's safe for nearly everybody. Well, it is safe for everybody. There are a few cautions to be aware of, but she's written a kind of summary in language that we hope everyone will understand. So if you're interested, that's a really good article to look at. And again, lymphedema, so swelling of most commonly your arm, but also your leg, particularly for people who've had surgery to the lymph glands in the arm after breast cancer. That can be really common. In the old days, we used to say, or patients used to be told not to exercise, but actually we know that resistance exercise is a really good thing to do. Again, on our Move website, there's a workshop that we did a few years ago talking about lymphedema with some really good suggestions on kind of explaining it, but also exercise suggestions and a review of the evidence. So neither of those are reasons not to exercise, but you'd be amazed how many people are still told not to move. If you are a healthcare professional or you're just interested in getting a little bit more information, this is a vaguely helpful. I say vaguely, most of our colleagues don't find it helpful. But I think a lot of my colleagues would say we don't really know how to bring up exercise, particularly if it's not part of their lives. Just has some suggestions for how you could bring that up with patients. This is, if you are a healthcare professional, something that I think is really useful. So they've got some really good documents for specific conditions. So chemotherapy for breast cancer, what should you be telling your patient? How much to exercise? It's probably would be quite interesting for patients as well, actually. Yeah, specific conditions. So you've got melanoma. What should you be doing? What can you not be doing? Lymphedema, bone metastases. So that I think that is a really, really good resource. Um, just showing you roughly what it looks like. It's quite easy to read. I can't see the top, but if you had a pill that did everything that exercise did, you would 100% be giving it to everyone with cancer. So my plea to all healthcare professionals whenever I talk about this is we have to give patients that information. And that is what Move Against Cancer is all about. It's about sharing the information, but also I guess supporting people to be active in a way that works for them, to make friends, to make movement fun. And yeah.